what it is, and what its effects are 8 years later. With us today, we have Robinson, Denver Chair of Political Science, and Aubrey Hasvold, the Advocacy Program Director with the Colorado Coalition for the Homeless. Welcome, guys.
Hello.
Yes.
Welcome.
So before we begin our discussion, can you guys tell our viewers a little bit about yourselves? Dr. Tony Robinson, would you like to begin?
Sure. So, good to see everybody. So, I'm Dr. Tony Robinson. I am chair of the Political Science Department at the University of Colorado in Denver, and an associate professor there. I teach urban studies, affordable housing and homelessness courses, gentrification and social equity, lead study abroads to Berlin and Korea to study these issues in an international context and see how other nations deal with these issues. And I've been involved with kind of affordable housing issues and homelessness challenges going back about 30 years. Grew up in low-income communities myself and have always made that a subject of interest that I want to learn more about, help more about, make students more aware of. And so that's been my work. I've conducted a number of research studies in the Denver area about the state of homelessness and how the policing of homelessness and kind of policies that we implement that affect the Denver area homeless population.
Hi, I'm Aubrey Hasvold. I'm the Advocacy Program Director at the Colorado Coalition for the Homeless. And there I work on governmental affairs. I'm a registered lobbyist. I do a good deal of coalition building and public education. And a little bit of background on the Coalition for the Homeless. We were established in 1984. And since then, we've grown quite a bit to have about 600 staff members. We house on any given night about 4,000 households through our 20 apartment buildings, as well as through relationships with landlords in the community. We have 5 health center locations in the Denver metro area and in southeastern Colorado. And we have about 50 wraparound services like vocational services, cooking, money management services to keep people housed successfully. Altogether, we serve about 20,000 people per year.
Awesome. Thank you, guys. So to begin our discussion, the University Events Instagram posted for our audience about whether or not they feel safer on a well-lit area or in a dark corner, and overwhelmingly they voted for the well-lit areas. We also posted a little bit of a fact that many homeless people prefer to find housing in safe well-lit areas like 16th Street Mall. But because of the camping ban, many individuals said that their sleeping habits had changed in significant ways. And coming from Dr. Robinson's study, actually 49% of the surveyed individuals said that their sleeping habits changed, which is an interesting statistic. So we're going to start with Aubrey. Can you give us a general understanding of who would be considered homeless?
Absolutely. So my definition is a little bit different than the official definition coming down from HUD, the U.S. Department of Housing and Urban Development. So mine would encompass anyone who lacks a safe, secure, sanitary, and fixed residence at day or nighttime. So HUD is a little bit more strict with their definition, and that's one of the reasons why we often end up with a severe undercount of folks that we know are experiencing homelessness. So they define it as anyone who's literally homeless, so anyone who's sleeping at night at a place that's not meant for human habitation. And that's how we're able to capture the number of folks we can estimate who are experiencing homelessness through the point in time count every year, which is federally mandated. And so we are missing out on folks who are sleeping in cars, who are couch surfing, who are doubling up, and folks who we just can't capture on the streets.
Awesome, thank you. And we're also going to get from Dr. Robinson a little bit for those who are unfamiliar with the Denver unauthorized camping ban. Dr. Robinson, do you mind going into a little bit of what it is?
Sure. The Denver unauthorized camping ban, or the Denver camping ban, as everyone calls it. Well, that was passed almost going on a decade now. And what it is, it's a law that Denver passed. Sorry for that noise in the background. I'm not sure. I'm sorry, there was some feedback there. So it's a law that states that anybody residing in public, if you are residing in public, you may not use any form of shelter from the elements other than your clothing. That's what the black letter of the law says, is that so those who live in public, those who look like they're residing, like a homeless person, they may not have tarp, like any kind of tarp against the elements. They cannot use a bedroll or a sleeping bag or a blanket at night. They cannot use an umbrella, actually, from the if you have a big umbrella set up to keep the rain off you. During testimony, during the passage of this bill where I was in attendance, police made it clear that they interpreted that you could not use like a newspaper over your legs, that a block of wood keeping your head off the ground is some kind of shelter from the elements if you were like some kind of crude pillow at night. Because the black letter of the law just simply says you may not have anything other than clothes to shelter yourself from the elements if you're residing in public. So in a recent newspaper article, they were asking police the difference between somebody who's taking a nap in a park, a picnicker taking a nap in a park, and a homeless person. And isn't the person sleeping in the park on a blanket? Aren't they violating the camping ban? And the police officer replied, well, no, because there's this issue of evidence of residing in public. Does the person look like they're using that blanket for the purpose of residing in public? If that thing is helping you reside in public, you can't have it. So that's what the camping ban does. And then it authorizes police when they find, the point of the camping ban was to allow police to kind of move people along who are sleeping in well-lit kind of downtown areas, 16th Street Mall. There were dozens of people, sometimes 100 people a night sleeping on the mall. And the police had a tool to require them to leave or to get rid of their sleeping bag because it was legal. This law allowed police to say you cannot use a sleeping bag. You cannot be on the mall sleeping at night. And that allowed them to kind of just move people along and push them like to say you should be go to a shelter or you should be moving along somewhere else, but you can't stay here. So it gave police a tool to kind of prompt homeless persons to be out of public, off the streets, and basically either invisible or at least not setting up some kind of temporary encampment with tarp, or trying to push them into shelters. So that's what the law does, and we've used it. Denver police have thousands of contacts every year with homeless persons telling them to quit using blankets or quit using that tarp or take down that big umbrella, move along. Thousands of times a year, the police admit, and it's documented through our research more than they admit, of constant move along orders to move people who are using shelter out of public places. Hello. I'm sorry, I'm not hearing anything.
Oh, so sorry. Hello, I'm going to jump in for Maya. It looks like she got kicked off for just a little interview, but thank you for sharing that. That was very informative. So our next question we had actually from an audience member was that the number of people exhibiting symptoms, sort of testing positive for COVID right now within Denver's homeless population is rising. Can you talk a little bit how we're dealing, we've seen what's happened so far, but they're wondering how we're dealing with the symptoms dramatically and those who are not when they're trying to get a bed in a shelter. Oops.
All right, thank you. That's a great question. And unfortunately, in looking at what other comparable cities are doing in response to community spread of COVID-19 among the population of folks experiencing homelessness, we are very far behind, which is disappointing. At the Coalition for the Homeless, we are working on triaging and testing folks on a daily basis. And what we're trying to do is make sure that folks who are exhibiting symptoms, first and foremost, and folks who have tested positive, at the Coalition, we've had 10 folks test positive so far, that they're able to self-isolate. And we've been able to contract with one motel so far in order to master lease and then get folks into those rooms. And we're about to sign a contract on a second motel. But that's been really challenging to get motel and hotel operators to want to work with us because we're asking to house people who are ill in their properties. And I think there's a lot of stigma around housing folks who are experiencing homelessness too. So we don't have nearly the number of hotel rooms we need in order to isolate folks. Mayor Hancock recently asked for 3,300 rooms for isolation, and Denver Homeless Out Loud estimates that we need about 4,000 to adequately isolate folks who need it. But as we're trying to get more hotel rooms, we have an interim solution that we've figured out with the city and with the state. We're going to be using the National Western Complex to isolate and house about 600 men at appropriate social distance. And we'll be at CCH, we'll be providing the healthcare and triage and testing at the National Western Center. We're also looking at another location for women and transgender folks, which we hope to have up and running soon as well. But there's a lot of work that needs to be done, and that comes through in a need for funding. We need more protective gear because we're not being prioritized as far as who needs that protective gear. And what we really need is for the governor to make hotels and motels available under his executive powers so that we can actually get folks in there.
Awesome. Well,
I'd like to just add something. I want to, first of all, I just want to be very appreciative of the kind of ground level work that organizations like the Coalition on Homelessness are doing, the work that Aubrey's doing, this kind of field level work, and the political energy that has come together around maybe making some more positive steps in response to this emergency, such as opening up more shelters that are proper distance between people, such as finding more motel rooms. There's a lot of kind of direct, immediate energy that is going into this, and that's very appreciated. I want to point to something else though as well, which has to do with this, the legal challenges that are out there that are interesting to look into that address this issue and what's happening legally and on a different plane, kind of. And what I mean by legally is it's interesting to observe, or it's important to observe, how nationwide this coronavirus emergency points out the differential impact of health emergencies based on race and class, and how certain people experience it much more profoundly than others. It's becoming increasingly aware that people who are non-white are more dramatically catching and dying of COVID-19. I think in Michigan, 35% of the deaths are African American, and only about 19% of the population is. So people with a pre-existing history of poverty or maybe pre-diabetes or poor air quality in their poor neighborhoods, they're catching the disease more. We also now know it's going to have a differential impact on terms of class and how much money you have. People who are able to shelter at home, when that order comes down, shelter at home, stay at home, there's evidence that a full 3 to 5 days earlier, people with money were able to make that happen and stay at home and be at home. People that had less money and needed to go to work every day, maybe, to keep their jobs, they were not able to shelter at home. People without homes, homeless, of course, had a tough time sheltering at home. So this raises questions of, it kind of has legal implications in terms of our Constitution. And we're seeing some of these challenges where people are pushing back saying, well, the Constitution guarantees equal protection under the law, guarantees everybody due process before their life can be violated. Well, when you have people without homes, and the governor is saying, as a public health emergency, you must stay home, does the Constitution, do we have a legal obligation to say we have to do more than legally, constitutionally, to be sure that all our citizens, all our residents have that equal protection and can stay at some kind of home? And I know that's the work the coalition's working at, saying it can't just be a big shelter that everybody's stuffed into. That's not a safe, healthy place. It needs to be a home. It needs to, as much as it can be, like a room, a hotel room. So I'm interested. There are these legal challenges, and they're here in Colorado. People are bringing challenges in the courts, saying, we legally are obligated to be a better country, and this virus kind of points out our obligations to do more. So I'll be interested to see how those legal challenges unfold.
Yeah, Tony, you make a really great point, and I'm glad you brought that up. And not only are the negative impacts of COVID-19 disproportionately hitting folks of lower income and communities of color, but the support that's available for folks, especially from the federal level, leaves those communities out too. So for example, the personal stimulus checks that are going to be coming to folks leave out people who haven't filed tax returns. Folks who make a low enough amount of money each year that they're not required to file tax returns. And a lot of these folks might be veterans, Coloradans, people on Social Security who are already tied in with SSA, but they don't have tax returns, or folks who are on TANF and SNAP who aren't able to get any sort of support through those state programs.
Really, so if you didn't file a tax return, you don't get that money.
That's right. And so people are going to have to file what they call a simple tax return. But we all know that for folks experiencing homelessness, it's not that simple, right?
Wow. So I didn't realize that that's important to know and to be aware of. But there are ways to help people, whatever, do some outreach and say, hey, here's how you can get that money. You have to do this extra paperwork.
Exactly, yeah. So to the extent that service providers have that capacity right now, while we're deep in response and crisis mode, yes, there is still time to fill out those simple tax return forms, but it's, a matter of capacity, certainly.
Yeah, wow.
Thanks. Well, thank you both for that. I know, obviously, COVID's a big one on everyone's mind, so that was a great question for the audience. I've got Maya back with us, so I'm going to have her jump back in to ask some more of the questions that we had for the homeless camp ban.
Oh, I don't.
Hi.
Oh, no, I do.
Maya.
Hi, sorry about that. So kind of going back to the start of the implementation of the Denver unauthorized camping ban, can you guys speak to some of the immediate effects that stemmed from the implementation? Dr. Robinson, would you want to start?
Sure. So the camping ban was passed, and just to frame it a bit, there's a big debate, the passage of the camping ban. Those that supported it said the whole point of the ban is to get people into services and to help them. It's a tough love approach. They use this word, they use tough love. Another word was compassionate coercion. What was it? Compassionate disruption. These meaning we are going to disrupt their lives. We're going to coerce their lives to force people to say, you can't just live on the streets. You need to get into services. You need to get into shelters. You need to accept, help from the medical profession. And that will improve your life over time. The reason you're on the street is because you're just behaving badly, and we're going to prompt you into services. That was what people said why they were passing it. They didn't want to harass people. They wanted to help people. Those that were opposed to the law said, actually, that's false. First of all, there aren't enough services available. If all these people tried to go and get adequate housing and adequate services, there aren't enough services available. There are many categories of people that can't get services, like stay in a shelter at night. Maybe you have a pet, or maybe you have a job that you work till the middle of the night. There are many reasons why you can't qualify for getting into services or into shelters. And also, the argument was this will just drive people into hiding and to be fearful of police and to be constantly moved along. The police won't give them services; they'll just move them along and keep them churning, and they will end up, finding hidden and secret places to sleep where the police can't find them. And there they will be vulnerable to being beaten up and robbed and have things happen to them. And they will have not good, there won't be a community, and it won't be warm, and it won't be well lit. So this will really harm people's lives in measurable ways, not improving anything at all. It'll just harm homeless people's lives. That was a debate. The law passed. The point of the series of studies we've done over the last 3 years, we've done 3 studies where we actually went out and measured what's the evidence show. Are people being helped or harmed by these laws? By the way we're policing it, are people's lives improving, or are actually people becoming more vulnerable to being beaten up or raped or the things that happen? So we've done a series of studies, and what we've discovered is the immediate consequence of the law, measurable right away, was people reporting far more contacts with police far more often telling them they had to move along because of the Denver camping ban. They had to move along because that's what police are ordered to do. You first try to move people along before you say, oh, well, can we maybe get you into a great service? So people move along because the police tell them to move along. So lots of orders to move along. People did move along. So that resulted in, and we could measure this through surveys and evidence, less average sleep for people. They got fewer hours of sleep per night. They were woken up more often by police. They were less likely to use any form of shelter from the elements, tents, bedrolls, which then resulted in, we documented this, increased incidences of frostbite, of sleep-related disorders, of mental health issues. Those things all became exacerbated by people who reported frequent contact with the police under the camping ban. There was measurable deterioration in people's quality of life. People began to go to find hidden places to sleep. In these hidden places to sleep, they were more likely to be beaten or raped, especially, of course, women in terms of sexual assault, but men also. And these things were all measurable. So the first immediate consequence was simply homeless people were like forced to move more often, to move to more hidden places, to become more fearful of police, and their quality of life deteriorated. What we did not find evidence of is any really significant increase in people moving into like permanent housing and getting their life together and getting great new services and turning their life around because this initiative prompted it. That was the hope, but that hasn't happened. We don't have evidence of that happening. The last point I'll make is we have some evidence of a small percentage of people increasing their desire to get into shelters because this ban is kind of the police are harassing them. And so there's some, more often they'll go to a shelter and try to get into the shelter. Some of that happened, although not much. But far more often, people were turned away from shelters who tried to get into shelter. So they would try to, but they get turned away. Sometimes because of space limitations at shelters, but more often because not everybody can get into shelters. They didn't meet criteria different ways. Some people have been 86 for like fighting or having, drinking in the shelters. Well, those people still need somewhere to sleep at night. They still must shelter somewhere, but they sometimes can't get into a regular shelter. Or they don't show up at the shelter till very late at night and the doors are already closed because, that kind of situation. So I guess I'll stop there and hope that gets to the general point, which is the most immediate consequence was to harm people's quality of life with very little measurable improvement in anybody's life. And that was the consequence of the camping ban.
Tony, to your point about some of those physical dangers about frostbite and hypothermia, dehydration, what we found in 2019 through our death report, which is a report of people who pass away on the streets every year. And what that showed is that between November 2018 and November 2019, 10% of deaths that we were able to record were related to environmental exposure. So the majority of that was hypothermia or complications due to illnesses in combination with exposure to cold environments. And in January of that year alone, 27% of reported deaths were due to exposure. So this is a number that is climbing every year that we've produced this report. And this, I believe, is absolutely related to camping ban enforcement, especially as it ticked up in 2016.
Let me sorry, Aubrey.
Go ahead.
To give some data to back this up, or to kind of link this to the camping ban, though we do know there's a lot of measurable death and harm from exposure. In our research, we've documented that 34% of everybody that was surveyed, and we surveyed like almost 500 people, 34% of respondents report the police have instructed them to quit using blankets, bedrolls, or other shelters. 50% have had their blankets, tents, or survival gear confiscated by police because they'll do raids and shut down these encampments. Among those who have had their bedrolls taken or instructed to quit using shelter, there is a 71% higher rate of frostbite, a 39% higher rate of dehydration, twice the rate of heat stroke. So these are, that's common sense kind of. If you take someone's tent, they're more likely to suffer from exposure to elements. But we have some documentation that this is happening because we go out and we survey hundreds of people. Those people that have been contacted by the police and had their blankets taken are more likely to suffer from hypothermia and exposure and dehydration. So,
yeah, those are powerful numbers. I'd also like to share some of the reports that I've gotten from some of our staff about how much more challenging our jobs have become because of the camping ban. The work that we do as direct service providers is based in trust and based in relationship building. And when people are moved along, those efforts are deeply thwarted. And when people have contact with the police, especially when it's not a positive interaction, that can disrupt someone's trust of any sort of authority figure. So that can make it very hard for us to deliver these critical services. For example, we've had folks who have missed their lease-up appointments to actually get into permanent supportive housing because we can't find them because they've been moved along, their cell phone has been confiscated, or because that relationship has been damaged. We've also had an inability of locating people that leads to delays in critical medical care. So for some of these things that we've just been talking about, and this can lead to worsening medical conditions and also an increase in spread of disease in the community. So examples might include hepatitis A or tuberculosis, and of course now COVID-19. But Denver's camping ban has made it so much more difficult for anybody who is subject to it to maintain good health and actually get back on their feet and pursue things like housing.
And how stunning it is that a court, a Denver County court, a few months ago, declared the Denver camping ban to be an unconstitutional form of cruel and unusual punishment based on this kind of evidence. They looked at this hard evidence. They looked at the research that Aubrey's talking about. They looked at some of the research I've talked about. They looked at testimony and others. And the court concluded this punishment for having to live on the street is cruel and unusual. People are dying and falling sick. Even though the court concluded that, Denver has immediately appealed that to the Court of Appeals. And while it's being appealed, Denver says, we're just going to keep enforcing it because we're able to. While it's being appealed, we can keep enforcing it. So although we have documented evidence that this ban is cruel and harmful, and we have a court decision saying it's cruel, Denver authorities are choosing to keep enforcing the law. It came up, and then City Council recently voted on whether or not to ban the camping ban or not, to reverse it. Councilwoman Candy Baca brought a proposal to reverse the camping ban, but Denver City Council stood behind the camping ban still. So it's a little disappointing to have our leaders looking at this evidence and ignoring it, but they are.
So I know you kind of touched on it, how they're not necessarily providing resources to those living on the street. They're more so like having them move to a different location. But the ban, when it was implemented, its goal was to improve the appearance of downtown as well as try to provide those resources for those living on the street who might have refused them previously. I know you kind of touched on it, but do you all believe that it had achieved what it was meant to do in improving and providing resources? Aubrey, do you want to start on that one?
Well, I was actually going to cite one of Tony's reports, actually, which is that of the, I think, 20,000 contacts since the beginning of the camping ban, only 4% of those roughly 500 survey respondents said that they were actually offered services. Is that right?
That's correct.
So I know it has not done what it was intended to do. And I think anybody walking down the streets of Denver still can see a lot of folks experiencing homelessness and can see the need for more investment in this area rather than just pushing the problem along. At the coalition, what we have, just some back of the napkin math, we believe that Denver needs to invest around $50 to $60 million per year indefinitely in order to actually make a dent in this issue and put up the resources needed to actually get people into permanent supportive housing. And one thing that I find really compelling is that through our social impact bond project, which is part of this Housing First model, which says that if you just get a roof over somebody's head, then we can take care of things like employment and mental health concerns and primary care concerns. And so through this project, we asked some of the highest utilizers of emergency services, jails, and emergency services in Denver if they would like the opportunity to be housed. So of the first 100 people we spoke to, 99 people said, yes, absolutely, I want to be housed. So to me, that says that there simply aren't enough resources available. It's not that people don't want to utilize them.
Yeah, I'm going to build on that and agree with this Housing First model for sure. And Housing First is just as Aubrey said, it simply puts some money into giving people houses, and you've solved homelessness. Shockingly, the provision of housing will solve it. And it won't just solve homelessness, as Aubrey said. All these associated issues immediately improve too. Drug and alcohol abuse, mental health issues, sanitation on the streets, all those things improve as soon as someone has a unit of their own, which everybody needs, which creates more mental stability, less likelihood of being, bluntly put, whatever, strung out on some, substance on the street. All those things improve. This question you asked, Maya, of have things improved, like downtown, have the beauty of the streets improved? Well, I think honestly, you can say 16th Street has changed since the camping ban. Before the camping ban, on 16th Street, it was legal for people to sleep all night. They could sleep all night with a sleeping bag, and they did. So there would be 50, 100 people, on a several block period of 16th Street, and the police had a hard time kind of moving them along. That's far less likely to occur on late night on 16th Street. There are fewer people on 16th Street all night in tents than there were before the ban. So you can argue, oh, that's been nice for 16th Street, and that's an important thoroughfare for the city. However, as we know, it isn't because everybody's gotten housing or integrated services. They've simply moved a few blocks off of 16th Street more often. So you'll find a lot more people sheltering just a few blocks off of 16th Street than they used to be. And so that's, there's that problem. And then, so the camping ban has not at all kind of overall changed the homelessness situation in Denver. It's moved people along a little bit. What would be a far better solution, and it wouldn't even cost as much money for the city. Yes, we need the 50 to 60 million, as Aubrey was saying, to like a serious structural longer-term solution. But there's immediate things the city can do, which is start saying, you know what, we're going to have little areas of the city where there are going to be zoning changes where you can put up tiny homes, where in this block area here, people can just put up a tiny little home that costs $5,000 and can live in it like a little unit. And there's people willing to fund those things. And we will allow a tent city in this couple block area. We'll allow people to put up tents without harassing them. And we will provide water and provide sanitation. So it'll be a kind of clean area. Those things, very low cost measures. As Aubrey said, many homeless people would desire them. They don't want to be sleeping in an alley, under a cardboard. They would like to live in something a little more structured. And if, maybe their situation is not like a permanent home right now that's large and typical, but a tiny home, a nice tent where you're not being harassed every night with some, toilets and water. People live that way all around the world and live that way productively. And we could allow it in Denver and it would improve the situation for everybody. Everybody in Denver would benefit from this reasonable solution that is low cost.
Yeah. That's a very good point. So, it's kind of going on again about the differences between what it was when it was first established versus now. But Dr. Robinson, since you published your study in 2013, were there any immediate kind of right when it happened after your study was published that there was like differences in treatment and behavior of the homeless population? Because I know the ban itself had its effects, but did your kind of survey of the homeless population after the ban do anything different?
I'm sorry, I didn't catch that last point. You mean after the surveys and the research, did they have a consequence? Did they lead to changes of some sort?
Yeah.
Okay, so I heard a couple things in the question of have homeless people changed their behavior? Have things changed? I think the fundamental answer to that is no, not much. People who are homeless are facing, deep structural issues of inadequate housing being available, jobs not paying enough, medical bankruptcies, these kind of things. All of that is a broad structural economic problem that has not changed at all. And so we have a similar number of homeless people. They're still surviving on the streets since the camping ban has happened. What is different for them, and it's no different than when the camping ban was passed, it continues to be the same, is that they are more easily the police more often and more easily are able to churn them. What I mean by churn is require them to move along. You must move along. They have a really good tool in this camping ban to do that. And that is a continuing reality that homeless people face today, just as they did like 8 years ago when the ban was passed, that they are just being harassed by the police. And the courts have agreed to that. As for changes due to advocacy efforts and research and all this, there's some evidence that things change a bit. Because of advocacy and research like this, we have examples of several downtown businesses backing off their support of the camping ban and saying we need to reconsider it. We have evidence of voters even starting to reconsider whether it's a good idea. That's happening slowly. However, voters did vote on this issue about a year ago and dramatically supported keeping the camping ban, although we have evidence that there's slow erosion of support. We have these court decisions. The court has come down with telling Denver they can't keep summarily just taking items from people and throwing them away, that they have to have a more reasonable process to warn people to hold on to those items, to return them, because people are having their like war medals taken, their IDs, their prescriptions, pictures of their family. Those things just taken and thrown away. So Denver police have been ordered to be more reasonable about that and to show respect for due process of law, that even homeless people have a right to possessions, and those are their possessions, and the police just can't take them. So that's happened. We've had a court order that says it's cruel and unusual punishment, court decision, and that is in the works as to whether it will be successful on appeal or not. So, I mean, there's some evidence, I think, that this camping ban is politically vulnerable and may not last. However, in a big picture, it's kind of a little bit of a small thing. The real issue with homelessness is a deep structural economic problem that we need hundreds of millions of dollars to build and expand low-income housing units, as Aubrey was talking about, and that's just that's a separate issue than the camping ban, and that's where the real energy needs to be, is how do we get hundreds of millions of dollars to expand low-income housing availability.
Yeah. And then Aubrey, Mayor Hancock made an announcement about efforts for people experiencing homelessness yesterday. Do you mind talking a little bit about that and the effects that it will have on the homeless population?
So you're talking about the National Western, right?
Yes.
Right. So this is definitely a step in the right direction in giving people an opportunity to social distance during the COVID crisis, because our shelters right now are so overwhelmed, understaffed, and overcrowded. People are sleeping shoulder to shoulder. If you drive by some of these at 5 or 6 at night when people are lining up, you can see how tightly packed people are. So while shelters and folks experiencing homelessness are exempt from social distancing and the stay-at-home order, that really does not solve the problem. So we need to find a way for folks to actually maintain that distance and stay healthy. And Mayor Hancock announced that we're going to, starting tomorrow, have the National Western Center available for 600 men to stay. It's voluntary, and there will be transit to and from, so people don't have to stay indefinitely, but there will be the opportunity there for people to maintain that distance and get mental and primary health care there, as well as get triaged and tested for COVID-19. So this, I know, is Mayor Hancock's plan B. He would have preferred a space where 1,000 people can stay, and to close down the shelters and bring in the National Guard to help with that administration of that. But this is still a step in the right direction. So we're still going to have a few shelters open downtown, but National Guard members are going to help run those, while current shelter staff head to the National Western to kind of manage operations there. And the coalition will be there doing the healthcare side of things. So like I mentioned earlier, while this is happening, we're at the same time working to get more hotel and motel rooms so that we can move people out from that congregate setting to a more individualized setting. But my hope is that ultimately, trying to deal with this emergent issue of COVID-19 among the homeless population is that we'll realize that, hey, we can actually address this homelessness crisis that we're facing, and there are things we can do, and there is a need. So maybe to some extent this will provide a model for ways that we can treat people more humanely going forward.
Can't hear you, Maya. Maya?
Now
we can hear you. Now we can hear you.
Do you foresee any major changes coming out of this COVID crisis in regards to the ban? Do you think that this will kind of bring light to how the ban isn't really effective when it comes to this type of scenario?
No.
No.
I don't. It won't have anything to do with the right. So Aubrey's agreeing. I don't think the ban. No, I don't think this crisis will lead us to like, oh well, maybe we should rethink the ban. In fact, unfortunately, if anything, it would go the other way a little bit, where they're like, we have these public health problems, and we need to, we have cleaner streets. And the way to have cleaner streets is to move people off the streets and to, harass them basically. And that was already mentioned in recent news reporting when they were asking the city, can you suspend enforcement of the ban? The mayor said, well, no, and we're not going to be trying to harass people. We are going to be focusing on cleanliness and public health. So this ban is, as when presented as a public health ban, may have more energy behind it. However, I think Aubrey's point is really well put, that there are other things that, there's potential that may have positive outcomes of this, which is we're showing that we have the energy and the will and the creativity and the money to set up this, hundreds of people in the National Stock Show at reasonable distance from each other and with Wi-Fi access and healthcare and all these things that is more reasonable than a normal shelter, which is often just a bunk barrack, one, half a foot away from the next guy or woman. And we're going to have a much more humane situation. And maybe if we can hold on to that and say, look, why can't we do something like this more permanently? Not only do we need more permanent housing, but just put more money into shelters that are more humanely operated with, more distance between people, with more services like Wi-Fi access. We did it during the COVID. Why not, somehow continue that as a model going forward? I hope Aubrey's right that, we find some way to do some of that.
But with regard to the camping ban, it is wild to me that we are still enforcing that right now. It's like doing the virus's job for it by
moving people
and sending them to other places where there are other people. It's the absolute opposite of what everyone else is being asked to do.
All it does is move people along. I mean, that's the essence of the police order, move along, which is what we're not supposed to do, is not move along. But that's
exactly.
Yeah.
Yeah. And I know Mayor Hancock kind of acknowledged that he had been talking to other mayors of other states and kind of getting an understanding of what their plans were. Are you all familiar with any kind of plans that are implemented in other states?
That's a great question. I believe there are maybe half a dozen or so cities that have suspended sweeps of encampments so far. So one example, I believe Portland suspended some part of that ordinance. I think Honolulu might have. There's a few of them. And then several places have taken really creative approaches. Many have master leased many hotels, thousands of rooms. So that's been really great. They started early and they recognized the importance of that, and were able to have a lot of success there. And then some places have taken advantage of empty fairgrounds and things like that to varying degrees of success. But like I said, I think Denver and I think Colorado's behind in that respect.
Dr. Robinson, do you have anything you'd like to add?
Yeah, I'm not aware of what other cities have been doing specifically in response to COVID regarding homelessness. So I can't really add anything to what Aubrey said.
Yeah. Okay, no worries. Yeah. I mean, do you have anything else you guys would like to add? We unfortunately don't have any more questions at the moment. Just kind of thoughts and opinions, anything?
I don't know. Aubrey, how what I just got an appeal from the Coalition on Homelessness right here in the mail. This just came.
Oh, did that?
This is my appeal they're asking for support from the public. And I suppose maybe some viewers out there have also received this or should know that there are organizations like the Colorado Coalition for the Homeless who are dealing with this frontline and who are expending resources very quickly. It says in this note that the Colorado Coalition for the Homeless provides help to 15,000 individuals who use the coalition as their primary healthcare provider. That's 15,000 people. And of course, they have limited funds to help pay for all that they need that keep facilities clean and safe, protective gear, testing kits. All these things cost money. And according to this note, the coalition is having to spend an additional $1.3 million over their budget just in the next 4 months that they don't have. It wasn't in the budget, but they have to do something. So, it's just, I don't know, just a thought that when you get this, you're like, wow, these organizations, where's the money coming from? And if the coalition's not taking care of people, then who is? Nobody. And we know that the disease doesn't just stick in certain populations. It's if people are not able to get treated, they're on our streets and they're in our communities, and that means everybody is less healthy. So I don't know. It's a real issue, and knowing that the coalition is trying to do the good work but doesn't have the money is something we should all be aware of. So keep it in mind. If you get one of these notes, you might want to respond.
Yeah, well, thank you for the plug, Tony, and I'm glad you're on our mailing list. You're probably getting all sorts of emails and hard copy mail these days. But if anyone is interested, please do join our mailing list. You can find that really easily. Just Google Colorado Coalition for the Homeless, and you'll get some of those appeals, and you'll also get action alerts. So that'll give you the opportunity to write your elected officials in a really easy format. We give you all the tools and all the language to do that. Right now during this COVID crisis, as well as just throughout the year in response to policies that are coming down at any level of government. We also have an advocacy network that the public is welcome to join. And we have trainings a couple, 3 times a year explaining how to get engaged with some volunteer opportunities, because we get a lot of requests for that. So I encourage anyone who's interested to search that or shoot me an email and let me know if you're interested, and I can get you linked in with that kind of opportunity.
Yeah. And we also, to conclude our discussion, we also at Bavaria campus want to let people know that students do have resources on campus, and we are actually going to post the links for those resources in the comment section. We do have our Auraria mobile food pantry on April 4th from 9 to 11 a.m. in the Walnut parking lot. And I do want to thank Dr. Robinson and Ms. Hadford for joining us today. And thank you all for tuning in. Have a great afternoon.
Thanks, Maya.
Thank you. Thanks, Maya.
Thank
Thanks,
you.
Aubrey. Bye-bye.
Thanks, Tony. Bye.